On today's episode, I answer how long you should give heartworm prevention tablets for, what dose of vaccine we should give to small dogs compared to large dogs. I answer what we should do if your dog is unwell but you've got no money for your vet. What is my dog's rash? What should I do? And why is my dog vomiting at night when he otherwise seems completely normal? But first, let's cue the music.
You're listening to the Dr. Alex Answers podcast, the show that answers all of your dog and cat health questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Hi, and welcome to the very first episode of the Dr. Alex Answers podcast. I'm Dr. Alex, the veterinarian behind ourpetshealth.com, where my aim is to give you the information that you need to help you look after your pet to the best of your ability. I'm so grateful that you're here sharing your valuable time with me, and we're bound to be meeting for the first time, so make sure that you're subscribed to this podcast. I've got loads more valuable episodes lined up that you won't want to miss. You can also get your question answered just by heading over to ourpetshealth.com/Dr. Alex Answers. Okay, so question number one is, how long should I give heartworm prevention tablets for? So the person who wrote this in says that their vet tells them that they should give them to her for 9 months, and yet a family member's vet says to give it to their dog for 6 months. Who is right? Well, HeartGuard was the tablet that was mentioned, and absolutely that needs to be given monthly, and it's given to prevent serious heartworm infection. Not only is it very serious, but it can also be life-threatening. Now, heartworm is spread by mosquito bites, and it's found in all 50 US states, and it's also present in Canada. But being mosquito spread and derived, the risk period is really going to vary depending on which times of the year the mosquito population remains active. And that's going to vary massively between different areas. So in some parts of the country, some parts of the world, that might be a year-round risk. But in other parts, then it's going to be a much more narrow window where the potential for your dog to contract and to suffer from heartworm is a risk. So that's really where the big variation is going to be. Also, while the general recommendation may be given for a specific area, it may be that certain years they need to have a longer treatment period. For example, if an autumn is particularly mild, then it might be that mosquitoes are active for longer in the year. If the spring comes early as well, then it might be that where 6 months might be normally able to cover and prevent heartworm infection, you might need to spread it out to 9 months. And because of this variation and the serious nature of heartworm infection, some people may prefer to play it safe and treat, or if their vets recommend treatment with heartworm preventatives like HeartGuard tablets for longer than maybe absolutely necessary, just erring on the side of caution. So that's definitely something to consider. But you should talk about these things with your vet. They're going to understand what the local risks are, what the local risk periods are, what the mosquito activity is, and they're going to be the best person to discuss those risks with you and to give the recommendation about what's appropriate for your dog in the part of the world that you're living in. So what's right for one person may be completely different for others. And obviously in other parts of the world or in other parts of the country, certainly when it comes to Canada and the far north, heartworm is not going to be a problem. So definitely talk to your vet. And that goes for any parasite control, because in different parts of the world we worry about different things. So it might be sandflies when it comes to leishmania, it might be just fleas and ticks are particularly prevalent at a certain time of year. But the situation is also always changing. So while 1 year you might want to treat for that 6 months, like I say, as time goes on as well, and with climate change, that recommendation may change. So definitely check this out with your vet as well. Okay, so question number 2 is, what dose of vaccine should I give to my small dog? Now, the question is about a particular rabies vaccine, but the answer rings true for any vaccine that we give. So vaccine dose does not vary based on patient size, unlike most other drugs. So it doesn't matter whether you've got a big dog, whether you've got a giant dog, or whether you've got a tiny teacup breed, the vaccine dose remains the same. So whenever a vaccination is given, the whole vial should be administered as per the manufacturer's label descriptions. Now, you might, depending on where you're listening to this, wonder why this is a question. Well, in other parts of the world and in different countries, some vaccines can be sold to the general public, so they don't have to be administered by a vet. But vaccination is an important part of any disease prevention and health optimization strategy. At the same time though, a full clinical examination to make sure health conditions are picked up early, as well as ensuring a dog or a cat is healthy enough for vaccination, is just as important. And so clearly I'd then recommend that having your pet vaccinated by a vet is the best thing that we can do. And it will also mean that you know that the vaccine has been transported, stored and handled appropriately so that you can be sure that it will still work. So vaccines are very sensitive, and they can also, if they're warmed up or if they're handled improperly, they can become completely ineffective. So it's definitely something to think about from that point of view. Right, so before we move on to the next question, I just wanted to let you know that this podcast is brought to you by the Our Pets Health podcast. That's my other show that brings you pet health information to help you prevent disease, keep your pet healthy, or treat them to the best of your ability should they become injured or unwell. And I discussed a whole range of different conditions and different treatments and different management strategies to help you do just that. Just search for Our Pets Health in your favourite podcast app and start listening today. Question number 3 is, my dog is really unwell, but I have no money for the vet. What should I do? So this owner's dog's leg is shaking badly. He doesn't want to walk. He's panting. He's very tired and he's just not himself, but they've got no money to go to the vet and they're asking what should they do for their old dog. Well, clearly there are many different conditions that can cause the problems that are described, and I'm afraid it's just impossible to give specific diagnosis or recommendations based on the information given, but online in general. And that's certainly I've discussed in other podcast episodes over on the Our Pets Health podcast. But while I understand that money's a problem, if it's at all possible, you should definitely have your dog checked out by your vet. It might be that a diagnosis can be made by examination alone, or that even if a diagnosis can't be made, then a home management or treatment plan can be advised. You know, even if you're not able to do any additional testing, that examination is so valuable. That discussion face to face with your vet is so valuable. They'll be able to assess your dog's quality of life and what's best for them. And that's the other thing to think about with any old dog that's struggling. It's important to really closely consider their quality of life and think about what's best for them. And I've spoken before about management changes that can be made to help painful pets, as well as discuss palliative care and ultimately timing of euthanasia. Now, while that's not something that you might want to think about, or you might be ready to think about, or maybe the time's not right yet, they are important things to consider ahead of time so that you're more prepared to help your pet when the time comes. There's nothing worse, and I hear it time and again in my consult room, when owners say, oh, you know, my last dog, I held on too long. I wish I'd let them go sooner, because they were really struggling, and those last few days, weeks or even months, you know, they weren't themselves, they weren't happy, and I really regret putting them through that. So those are some things to consider as well.
You're listening to the Dr. Alex Answers podcast.
So question number 4 is all about skin, and it is, what is my dog's rash and what should I do? So the question is about a rash on the tail. It seemed like a hot spot at first. It caused itching, licking and gnawing. The owner went to the vet. They were prescribed an antibiotic and anti-inflammatory. It seemed to improve at first, but you know, now it seems to be irritating and it's spreading. But their dog is otherwise active and happy. So skin conditions can be incredibly frustrating, and I say that all the time when I first see a skin condition. A lot of the time they clear up very well without being seen again, but when we've got chronic, long-standing skin rashes, skin lesions, then it can be very frustrating to try and get to the bottom of that. So that's the first thing that I would say. Now, a skin rash can be caused by many different things, and that could be just a wound, an insect bite, skin allergy, or parasites like fleas and mites, and various other conditions as well. Now, surface infections can be treated very successfully with topical medication, but deep skin infections can require many weeks of antibiotic tablets to cure. So if it's getting worse, we want to be certain that there's not a deep infection that needs antibiotic tablets to treat and to cure. Also, whenever initial symptomatic treatment fails, then it's important to try and get to the bottom of the underlying cause, and that can involve taking a detailed history that includes recent parasite control, diet, previous skin complaints, and then also we can take samples. So that could be skin and hair samples, for example, that are then looked at under the microscope or sent off to the laboratory to look for bacterial or fungal disease that might be present. And different diseases, especially when it comes to fungal diseases, are prevalent in different parts of the world. Parasites also, you get parasite transmitted disease, so it's not just fleas and ticks, but it could be diseases, skin diseases that are spread by insect bites, that kind of thing. And then the final thing to mention is that if a dog or a cat, if they continue to lick a problem area during the start of treatment, then it's potential that no treatment is going to get that under control, because they're going to be continually damaging their skin. And that's just going to perpetuate that irritation, and it sets up this vicious cycle where they're itchy, they lick or they scratch, which causes temporary relief but causes more skin damage and then causes more itchiness. So to stop that from happening, an Elizabethan buster collar might be needed, a cone of shame, or the area might need to be covered with a bandage or something similar, just to prevent them from causing further damage. Although clearly that's not a long-term solution. We should be looking at to determining what the cause of the skin lesion is and actually treating that specifically and effectively. So all that being said, you should also remember that the information that I give in these podcasts is not a substitute for a consultation, an examination with your pet's veterinarian, and it should not be taken as a specific advice for any individual pet. If your pet is unwell, injured, or suffering from any kind of problem, talking to your vet is always the best course of action. Right, so that being said, let's get into question number 5. And that is, why is my dog vomiting at night when he's otherwise completely normal? He seems completely well. So we've got a middle-aged pug who is vomiting in the middle of the night for the last 5 nights in a row. Otherwise, he's acting normally. He's not sick at all. Otherwise, got no diarrhea. He's got a good appetite. He's not losing any weight. What's the problem? What could be causing this, and what can you do? Well, vomiting, much like my previous question, vomiting can be due to a large number of different causes, and based on the information given, we can't make a diagnosis. The most common reason when a dog is otherwise bright, they're eating and drinking normally, and is not on any other medication, they've got no diarrhea, is a simple gastritis or inflammation of the stomach. Now, these cases, they'll typically settle down after a few days being fed a bland intestinal diet, but there are many other causes such as ulceration of the stomach, bacterial overgrowth, inflammatory bowel disease, liver or kidney disease, parasitic disease, to name but a few. And any dog who is vomiting multiple times a day, any dog that is also unwell and vomiting, or when the vomiting doesn't stop after, maybe 3 to 5 days of just symptomatic dietary management, they should definitely be examined by their vet, as further treatment is likely to be needed. So, even in a dog who's otherwise well, who is not got diarrhea, who is not losing weight, it's definitely worth getting them checked out. It might be that a different diet is suggested and nothing major is carried out, but it's always good to get a baseline check. So then if weight does start to drop, then we've got a weight at the start of the problem. We can look for trends. We can try a few minor management changes before needing to jump into something more serious when a dog or a cat becomes more seriously unwell if their vomiting still doesn't stop. So as with all things, check with your vet, get them checked out, and hopefully get to the bottom of the problem. Right, so that's it for this very first episode of the Dr. Alex Answers podcast. Make sure you subscribe, and if you've got a spare couple of minutes, I'd love it if you could leave me a review on iTunes or over at ourpetshealth.com/review to help more people discover this podcast and allow me to help more pets. But until next time, take care.
You've been listening to the Dr. Alex Answers podcast. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show where you ask the questions and Dr. Alex answers.